Okay. Good morning, everyone. I will welcome you to this great event, which we have long awaited, and we are happy that today we are here eventually. Like we said, the time for this event is 10:30 local time. We'll have just 2 minutes to commence the event proper. While we wait for others to join us, for those who are here, you can use the chat box. Just introduce yourself so that people can know who you are. Introduce yourself using your name, your profession, and the country you're joining from. This program promises to be a very interesting program, and a whole lot of events lined up for today. Brilliant, stimulating sessions, and I look forward to a very inspiring moment, and I hope you do too. Okay, we'll start within a very short time, and welcome again to this event. Thank you. Okay, dear colleagues, ladies and gentlemen, we again welcome you to the World Day for Health and Safety at Work. This is the African event put together by OSH Africa in partnership with ORP Foundation and other partners across the world. Yeah, we'll comment now. Like you know, the theme of the event is anticipate, prepare, and respond to crises, and invest in resilient OSH system. So whatsoever we're discussing today will revolve around the theme and the sub-theme. So I welcome you all once more, and please, if you are not speaking, we will need you to mute your mic. And if you have questions, if you want to say something, you use the raise hand application so that we can see that your hand is up. We'll call you up, I mean, to ask your questions or to say whatever you want to say. And this event promises to last for 2 hours. We have great partners that are with us today. We have the National Institute of Occupational Health, South Africa. We have the European Network Education and Training in Occupational Safety and Health, that's NETOS, Germany. We have the African Union Development Agency, South Africa. We have the Workplace Without Borders, Canada. Then we have the African Regional Labor Administration Center, Zimbabwe. Then we have the World of Safety and Health, Asia. So these are the partners we have that will be giving us a welcome message today. But above all that, we have our great co-hosting partner, ORP Foundation, Barcelona, and we thank you all for coming for the program. So while we set the program going, we also have ITUC Africa. I forgot to mention that also. While we commence the program, we call on my very dear colleague, Tutu Labafo. Tutu Labafo is the Vice President of Africa. She will be giving her opening speech, after which we'll introduce the next panelist to follow up after. Tutu, if you are here, please unmute yourself and put on your video and give your opening speech. Thank you.
Thank you, Ehi. Sorry about that. I just need to show you my branding and then I will continue with my speech. Program Director, who is our OSH President, Mr. Ehi Eden, the President of the Occupational Risk Prevention Foundation, Spain, and co-host, Mr. Hans-Horst Konkolewski, our distinguished guests and speakers, ladies and gentlemen, particularly members of OSH Africa, a very good day. On behalf of OSH Africa, I welcome you to today's webinar in recognition of World Day for Safety and Health at Work. As OSH Africa, we support this year's theme from the ILO, which is anticipate, prepare, and respond to crises. Invest now in resilient occupational safety and health systems. This could not have come at a more opportune time when the world is in the grip of a global pandemic, COVID-19. The pandemic has shown up major shortcomings in our economies and our health systems, and these have had a big impact on occupational safety and health. In South Africa, for example, reporting on occupational health decreased dramatically in 2020, and we had to make major adjustments to our occupational surveillance systems, which could not be run in congregate settings. The epidemic has, however, been also an opportunity for great learnings, and these learnings will be used to build more resilient occupational safety and health systems into the future. I take this opportunity to introduce OSH Africa to those who are not aware of this organization. Occupational Health and Safety Africa Foundation, OSH Africa, was formally established in 2018. It is the result of the visionary and gigantic efforts of a number of passionate occupational safety and health practitioners around the continent who kept meeting at global conferences, and they would ask themselves, what about us? What about occupational health and safety in Africa? How are we improving it? The vision of OSH Africa is an African continent free of occupational injuries and diseases, and each worker returning home from work unharmed. We have 8 objectives for the organization, but I will only mention 3 of these. The first objective is bringing together occupational safety and health professionals and associations across Africa and creating an enabling environment for collaborative work and sharing data on occupational health and safety. The second is to support the training and education of occupational safety and health professionals. And the last I will mention is facilitating exchange of information and experiences across the African continent. The above objectives are firmly aligned with our webinar today. Our organization has grown from strength to strength over the past 3 years and has developed very strong collaborations across the globe. Today's event is testimony to such great collaborations. As we celebrate this World Day for Safety and Health at Work, I wish us fruitful deliberations and valuable exchange of experiences across our continent. May this culminate in the improvement of occupational health and safety on our continent. Thank you very much.
Thank you so much, Dr. Tutula Bafo, for such a very insightful opening speech. So at this juncture, join me as I welcome Mr. Hans Konkolewski, the president of ORP Foundation Barcelona, to give his opening speech.
Thank you very much. Yes, thank you very much indeed. Ladies and gentlemen, dear colleagues and friends, it is a special honor for me to greet you all on behalf of the International ORP Foundation on this special occasion to jointly celebrate the World Day for Safety and Health at Work. The 28th of April marks the commemoration day for dead and injured workers initiated by the International Trade Union Movement 25 years ago in 1996. Its purpose is to honor the memory of victims of occupational accidents and diseases by organizing worldwide mobilizations and awareness campaigns on this date. Since 2003, the International Labour Organization, the ILO, celebrates the World Day to promote the prevention of occupational accidents and diseases globally by focusing international attention on emerging trends in occupational safety and health and on the magnitude of work-related injuries, diseases, and fatalities worldwide. This year, the ILO has devoted the World Day to raise awareness and stimulate dialogue on the importance of creating and investing in resilient OSH systems by drawing on both regional and country examples in mitigating and preventing the spread of COVID-19 at the workplace. Dear colleagues and friends, the pandemic has acted like a huge stress test of the robustness and resilience of national health protection, health prevention, and healthcare systems, revealing both weaknesses and strength. In particular, healthcare systems were ill-prepared and overwhelmed by the speed and magnitude of the pandemic. The lack of adequate protective equipment alone caused infections amongst hundreds of thousands of healthcare workers during the first month of the outbreak. Since the situation has been somewhat improved, and we have also witnessed how governments, public and private employers have taken positive steps to protect their employees from the virus by introducing massive home and teleworking, and where this is not possible, to take necessary surveillance and prevention measures to ensure that infection risks at work were controlled. The International ORP Foundation is pleased to team up with OSH Africa on this very special day for the global prevention community. As stressed by Dr. Balfour, we both believe that while the pandemic has caused, and unfortunately still is causing, a lot of disruption and pain, it has, on the positive side, globally raised the attention to safety, health, and well-being. As the theme of today's World Day suggests, it also has highlighted the importance of resilient health prevention and protection systems, and the need for a strong prevention culture amongst governments, business leaders, and in society in general. It is now widely recognized that we need a prevention culture that is firmly based on the Vision Zero mindset, that all accidents, diseases, and harm at work is preventable if the safety, health, and well-being of people come first. The pandemic has shown that besides the existence of comprehensive OSH policies and systems, the key to building a resilient prevention culture is the mindset, the knowledge, and the behavior of people. That employers and managers care about their employees. That each of us is not only caring about ourselves, but also about the people we are with in our families, our communities, and at work. With 3 simple measures, keeping distance, wearing masks, and washing our hands, we learn to protect our lives and the lives of others. Let us build a safer and healthier future based on the Vision Zero mindset. Let us democratize prevention, and let us leave no one behind. The International ORP Foundation looks forward to working closely together with OSH Africa in our common efforts to promote a healthy and sustainable culture at work and beyond. I wish you a successful World Day for Safety and Health 2021 celebration. Thank you.
Thank you so much, Hans, for such a very insightful welcome message. And thanks for the reassurances. Thank you so much. So at this point, ladies and gentlemen, we're moving to the next item on the program. Please join me as I welcome Dr. Spo from National Institute of Occupational Health, South Africa, to give her opening address. Dr. Spo, please.
Good morning, good afternoon, and good evening, everyone. Thank you to each and every one of you for joining us at the 2021 World Day for Safety and Health at Work, which is an African event. My name, as Ehi has said, is Dr. Spo Labanon. I'm the Executive Director of the National Institute for Occupational Health, fondly known as NIOH in South Africa. And I've been asked to just say a few words to this in this 2-hour virtual event organized by OSH Africa and its partners. As we know, the theme for this year's World Day for Safety and Health at Work could have not been more appropriate. It calls for us to anticipate, prepare, and respond to crises by investing now in resilient occupational health and safety systems. The responses to COVID-19 across the world in most countries suggest that investment in social infrastructure, which is healthcare systems, has been long neglected, in particular occupational health and safety systems, with the majority of funds having been spent on other issues, but especially on economic infrastructure. As the NIOH, we have witnessed how some of these organizations crumbled, collapsed under the COVID pressure, while others emerged strong. The coronavirus pandemic has highlighted the need to focus on inclusive and robust occupational health and safety systems. And this is our opportunity as the occupational health fraternity to lead in providing solutions to respond appropriately and proactively to crisis, using coronavirus as an example. The NIOH found itself at the forefront and had to embark on training activities to empower employers, employees, and practitioners and labor in at least being aware of what occupational health is. We are pleased to announce that at least in South Africa, we have witnessed an increased uptake of occupational health within many workplaces. You now go to a shopping mall and in any of the traditionally not well-versed occupational health occupational health workplaces, where people now talk about occupational health and they know about the risk assessment, our risk assessment, the occupational health risk assessment, and the control measures that need to be employed. So at least we have done something good as the occupational health fraternity across the world, and this is our opportune time to strike while the iron is still hot. The NIOH looks forward to continue supporting the efforts of occupational health in Southern Africa, and in particular, your efforts as OSH Africa. I'd really like to take this opportunity to commend OSH Africa, the board that is led by Mr. Ehi and other supporting partners for this great initiative that I think contributes to building occupational health and safety discipline within the African continent, and it aims to come up with specific solutions for Africa. And I think it's appropriately positioned to do so. Finally, I would just like to encourage the delegates to participate and engage fully in the discussions that will ensue, and I wish everyone a successful event. My last wish is that we should not only be hearers of what is being said here, but let us be doers, let us be implementers. Here is to a better Africa in the hands of Africans in occupational health. Thank you very much.
Thank you so much, Dr. Spo, for a very insightful message. We really appreciate that, and we look forward to a further collaboration in building the Africa that we want. Please, at this point, please join me as I welcome Dr. Ulrike Bowman. Dr. Ulrike Bowman is the coordinator of NIOH to give her welcome address. Dr. Ulrike Bowman, please.
Thank you very much for inviting me to make a short statement here. And only to mention, we have a memorandum of understanding between NIOH, this European Network for Education and Training, and OSH Africa since 2019. I would like to draw your attention to education and OSH. On the one hand, to the importance of safety, health, and well-being in the context of school, and on the other hand, to the training of future OSH experts. There are good examples in the context of kindergarten and school in Africa. For example, the activities on safety for children in the framework of Safety Chick and their Train Them Young initiative. We all are familiar with Ugoshi and her activities, but also the measures for head teachers and teachers to reopen schools after the pandemic. organized by University. And only to mention it, in 2020, there were 288 million of learners in Africa out of the schools due to the closures. Let me bring this to a point. The safer and healthier a school is, the more resilient it is. The situation of OSH professionals in Africa is quite crucial. I guess Dr. Moyo will come back to this later. The more important is the effort of OSH Africa's Education and Training Committee to develop online modules to train future OSH professionals tailored to the African context and needs, in combination with the trainer online courses organized by University. Let me emphasize, both online offerings are based on the African qualifications framework to ensure their national and international comparability and recognition. And by the way, here, the African qualifications framework was earlier than the European one. Arusha, maybe some of you are familiar with it. My conclusion, a resilient OSH system requires, first and foremost, investment in resilient people through education and training. But resilience, adapting to change, is not enough. We need to build the next generation of online learning to inspire and train change makers for a better future in Africa and around the world. Thank you.
Thank you so much, Ulrike Boma, for such a very insightful message. We appreciate that, and thanks for joining us today. And we appreciate our partnership even in going forward. Okay, thank you so much. Please, at this point, join me as we welcome Chiwewe Chadimba. She's the Senior Program Officer and Policy Specialist for African Union Development Agency, to give her welcome message. If Chiwewe is here, can you please let's hear your message?
Yes, I'm here, but unfortunately, it looks like the host has to allow me to share my video, so I may have to do.
Natalie, can you please give her that right? Thank you. Can see you now.
No, I have been given the right. Thank you very much. All right, thank you very much, Ahi, and my fellow panelists. I would like to thank OSH Africa and partners for inviting the African Union Development Agency on behalf of the African Union to this event. It is quite a very critical event and an important event for the continent. And we really feel privileged and honored to be part of this discussion. I think the importance of occupational safety and health cannot be overemphasized. The people that spoke before me have noted why it is important now than ever before, more especially because of the COVID-19 pandemic that the globe has gone through in the last 1.5 years. I think if we go back and look at the situation on the African continent, outbreaks and pandemics have been a way of life somehow. Let's look back, and we will recall that the continent has not yet recovered from the Ebola outbreak that engulfed West Africa before, and it is now in Central Africa, DRC, and we are still struggling with Ebola. We've had other outbreaks, yellow fever, we have choleras almost every year, mushrooming here and there. We have chikungunya, which is peculiar for the African continent. And also, even within these ongoing pandemics and outbreaks, you see that there are others that still are having an impact on us, ongoing pandemics such as tuberculosis and HIV/AIDS, which I think makes the situation complicated and makes OSH and OSH being resilient a critical component of development on the African continent. Let me talk in particular about COVID-19. The COVID-19 has had its own impacts in the workplace. We've seen the impact that COVID-19 has had on labor supply. We saw economies closing, but then opening up again. We've seen workplaces, as I think someone earlier said, that there are some workers that can work from home. The companies have adapted to working from home, but there are some that still have to go to work. And all these scenarios require us to invest in proper occupational safety and health regimes. In the African continent, we have seen the African continent adopting the AU Agenda 2063 as the blueprint for economic development on the continent. Accompanying this, we have adopted the Continental Free Trade Area, which is also another way of opening up the continent so that we are able to trade with each other. However, what remains constant and what remains important in all these scenarios is that the working population are the ones that will drive these development agendas. It is the workers that are going to move the continent to where we want it to be, and hence the need for us to invest in occupational safety and health. And we really thank OSH Africa and partners that have worked in supporting the African Union to move this agenda forward. We, as the African Union Development Agency, we have been working with our member states to support them in building resilient occupational health and safety systems. In the wake of COVID-19, most of the countries have been caught in a situation where they have minimal capacity in occupational safety and health, minimal legal frameworks to regulate occupational safety and health, and hence the need for all of us to work together to support countries to be able to build their capacities and build these systems that will be able to make them stronger and resilient in the event of outbreaks and pandemics. As the AUDNFAT, we are committed to supporting the efforts of key partners that we have worked with before, the OSH Africa, ILO, NIOH, and others, as well as African governments that are working towards improving their systems and in more particular, improving their human capacity as well as their legal frameworks to be able to provide services to their population. This commemoration comes at a very good time, at an opportune time for us to reflect and look back. Where are we and where do we want to go as African countries and as a continent together? How do we support each other in building resilient occupational health and safety systems? We look forward to the outcomes of this discussion. We look forward to the resolutions that will come from this discussion, that they will contribute to the agenda of improving health and safety at work on the African continent. Let me once again, as I end, thank OSH Africa and partners for inviting the African Union to be part of this discussion. Thank you very much.
Thank you so much, Chiweme, for such a very insightful presentation. We appreciate that, and we continue to work together in developing OSH across Africa. Thank you. So at this point, join me as I welcome Miriam Levitsky. She is a board member and the Secretary General of Workplace Health Without Borders, Canada. Miriam, are you here?
I am here. I need permission to start my video.
Natalie,
okay, I can do that now.
I can do it. Yeah, go ahead.
Okay, thank you so much. Thank you so much for inviting us to speak here today. I am in Canada, where it's quite early in the morning. Very happy to get up to say hello to all my friends in Africa. For those who don't know us, Workplace Health Without Borders is an all-volunteer organization dedicated to building capacity in occupational health and especially occupational hygiene around the world. It was started by occupational hygienists. Most of our members are hygienists, but we now have members of all kinds who are dedicated to occupational health. When we think about the theme of today, anticipate, prepare, and respond to emergencies, we realize, one, how important workplace health is, and also how the world kind of fell short on some of those elements, anticipating and especially preparation. Here in Canada, the pandemic is in the worst phase it's been yet. And we've learned a lot about what we still need to learn. We've learned, for example, that the pandemic is being spread primarily through workplaces. And it's the failure, I think, of the world to recognize the importance of workplace health that has led a lot to the position that we're in right now. Of course, we've all had to be working at home during the pandemic. Prior to the pandemic, we ran some courses, especially courses from the Occupational Hygiene Training Association in Africa, in partnership with some of you. And since the pandemic started, of course, we've had to move to online training. We were delighted to partner with ASH Africa in a recent training in occupational health and safety awareness with Ehi and Dr. Moyo were some of the volunteers who delivered that. And we've learned a lot about the opportunities for further partnerships like this and how the barriers between workplace health and public health are something that we must tear down. Because if the world does not give greater importance to workplace health, we fear that we may be in for other emergencies such as the ones we're going through right now. So we really do hope that we can continue to work with you. I see some friends online that we've seen before. We run webinars monthly and welcome everyone to participate with us. And we really look forward to a wonderful further of our partnership. And thank you so much for inviting us here today.
Thank you so much, Miriam. That was very insightful. We appreciate the partnership and the opportunity to continuously work together in building the Africa that we want. Thank you so much. So at this point, join me as we welcome Dr. Lokari Labanon. He's a director at African Regional Labor Administration Center in Zimbabwe. Dr. Lokari, are you here?
I'm here, Mr. President. Can you flight my picture, or I can do it directly? My video.
We can see you now. You can go ahead.
Okay. Okay. Can you hear me now?
Yes, we can hear you.
Thank you very much, Mr. President and the program director. Good day, colleagues. I'm very delighted to have been invited to this very important occasion. Let me take this opportunity to welcome all our guests, distinguished participants, and esteemed speakers to this year's World Day for Safety and Health at Work 2021 event. I must admit that I'm immensely awed by the huge attendance at this very important occasion. Allow me, Mr. President, to take this opportunity to commend you and through you, OSH Africa, for your commitment to ensuring hazard-free workplaces in Africa. Fellow participants here will agree with me that the organization has done exceptionally well in the few years of its existence, and Africa can only celebrate the birth of OSH Africa as a blessing to the continent. Ladies and gentlemen, today, occupational safety and health resonates very well with the concerted national struggles for balanced social and economic development. The impact posed by safety and health at work on the national development paradigm must be understood, recognized, and prioritized as the surest way of making decent work a reality. The issue now is to focus more on preventive occupational safety and health measures, especially in light of the challenges posed by global pandemics such as COVID-19. Workplace stakeholders should therefore agree that they are faced with a succinct challenge to which they have to respond through a system of occupational safety and health management. They must agree also that occupational safety and health management plays an important role in promoting equitable socio-economic development by providing indispensable health protection to the largest portion of the population, that is the labor force. To that end, government should agree and get its policies right by establishing comprehensive workplace protection policies based on international standards and demonstrating perpetual commitment to the principles and practices of consultation and collaboration in this process. Employers, on their part, should agree and provide systematic safety work by conducting regular risk assessments and executing risk elimination programs at the workplace. Employees, too, must identify and report all hazards in the work environment and maintain safe work. OSH practitioners equipped with the necessary skills and credentials, must tirelessly enforce OSH policies and regulations, and hence impact the workplace in a positive and productive way. As an institution seized with capacity building in the field of labor administration in Africa, ALAC feels very excited to be associated with OSH Africa. We look forward to continuing and concretizing this collaboration going into the future. Once again, ladies and gentlemen, I cordially welcome you to this event. I wish you fruitful deliberations and a very successful World Day for Safety and Health at Work 2021 event. I thank you.
Thank you so much, Dr. Lokari. That was a very brilliant and insightful remark. We really appreciate you, and continuously we'll keep pushing this until we get the kind of Africa that we advocate for. Thank you once again. Please, at this point, join me as we welcome the final welcome address from Justin Woods. Justin Wood is the co-founder of World of Safety and Health Asia, and they are partners in Asia. Justin, are you here? Please, Natalie, help me authorize Justin so that we can hear from him. Thank you.
Okay, I think I fixed it. Good afternoon. It's good afternoon for me anyway. As I'm based in the Middle East, I think it's still good morning for you guys. I'm very pleased to start off with. I'm very pleased to be involved with OSH Africa. We were late coming in, but we managed to get it through. And I'm really excited for the future developments of what we can do as two entities collaborate together to certainly help safety people, safety professionals in the field, and help them in their journey of certainly understanding key aspects of occupational safety and health. I'll talk a little bit about WSH Asia. We are fairly new. We were founded in 2016 by a gentleman called Raymond Watt, who is still based in Singapore. Myself and Raymond have worked together on many projects behind the scenes for some time. And without showing my age, we hold over 100 years experience between us, that is, of course. So I opened the Middle East office in 2020. Within the pandemic, it actually helped us develop a good safety, a strong safety platform to help safety practitioners. With my opening of the Middle East office, we then started to venture into Africa, which we've certainly got involved now with OSH Africa, as I say, to certainly support the members and the safety people of Africa. We do have some good areas within the platform of WSH, anything from information to safety equipment and learning also, because as we've just heard already, learning is a massive tool for us within our safety fields. I will offer OSH Africa throughout the duration of 2021 and onwards to run some remote masterclasses in key areas of safety. I've been working with safety groups and safety foundations for quite some time, so it's always kind of a good professional development platform for us all to kind of learn off others. I think that, once we can get a live event going, again, we can keep the classes running. But the most important message I have through WSH and OSH Africa for all you safety people is certainly create a good foundation in your companies. Certainly in terms of projects, do a lot of research and focus on the people who's within your entity. And analyze the safety performance from risk and hazards. We call it white paper document, but many companies will call it that we'll have safety assurance standards. And like I say, we can use each other, if you like, to really benefit from such a platform like OSH in Africa, where we can reach out to others. So I know, as I say, it's early days for us at the moment with our collaboration, but I am very excited on what work we can do. I'm sure that I can bring some of my ideas to the table, which has worked in other regions, whether they're established or developing. And it's the safety people, the safety professionals are the ones who will really benefit from our work. If we save one life, I think we win. And that's the most important thing.
Absolutely, absolutely.
Thank you very much. Pleasure.
Thank you so much. Thank you so much. I really appreciate such a brilliant presentation. Thank you so much, Justin. We'll keep working together hand in hand in ensuring that we keep saving people in their workplace and doing what we have to do. There is a call to duty for life. Thank you so much. So at this point, ladies and gentlemen, I want to present to you the first speaker for the day. We're entering the paper presentation sessions right now. Permit me to welcome to the microphone Dr. Moyo Dingani. Dr. Moyo Dingani is an occupational medicine physician. He is from Zimbabwe, and he is the Secretary General of OSH Africa. Dr. Moyo, please, the floor is yours. Thank you so much.
Thank you very much, Mr. President. Good day to you all across the globe. It is indeed an absolute pleasure this morning on my side to deliver this presentation on such a very important occasion, where I'm going to speak about the OSH priority investment areas for Africa in order to be able to anticipate, prepare, and respond to crises. Underpinned by a theme of investing now in the resilient occupational safety and health management systems. As has already been said, I'm Dr. Moyo from Zimbabwe, an occupational medicine specialist, OSH consultant and researcher, and I'm an honorary lecturer at the University of the Witwatersrand at the Midland State University. This morning, my presentation outline will touch on the greatest lessons learned from COVID-19 and then squarely address the key issues or facets of a systematic approach to occupational safety and health. And then I'll zero upon the anchoring principles of anticipating, preparing, and responding to crisis through a transformative approach to OSH. As an introductory note, the advent of COVID-19, which came unexpectedly with great speed, subjected all occupational safety and health management systems to test. And it was evident that there was a glaring deficit across the globe in terms of the integrity and comprehensiveness of the systems to manage OSH issues. COVID-19 came at a time when the world was seized with this inexplicable excitement and amazement with the advent of the fourth industrial revolution, where the discussion was on the cutting edge innovations, transformations that were going to be brought in by the fourth industrial revolution. But when the COVID-19 whirlwind came into the stage, it completely changed the scenario and the dimensions of operations across the globe. Even the so-called highly competitive organizations, we are dead strong on great reputations in terms of their product delivery, they were all compromised because the impetus, the force and the speed with which COVID-19 came into the center stage brought the world absolutely home. All that this was meant to portray is the gross inadequacies of our occupational safety and health management systems, both at organizational, national, regional, and international levels. COVID-19 brought with it inexplicable disruption and entropy, where suddenly, unfortunately, all work processes became experts in COVID-19, even those that never had any grain of information or know-how on occupational safety and health, suddenly there was a sprout of all these professionals. The rapid spread of COVID-19 brought with it unparalleled deaths and threw the world into a reactive state, where even the health services across all countries were overly inundated and grossly overwhelmed and could not cope, all resulting from a biological hazard with a myriad and a multiplicity of manifestations across the key hazard categories. And unfortunately, the world was not prepared to deal with this. We know that in keeping and in tandem with today's message of anticipating, preparing, and responding, which is ideally supposed to be the preferred approach, where initially you anticipate occupational safety and health issues in the workplace or at country level. When you've anticipated, you then establish your robust and comprehensive preparations so that when the response comes, it is coordinated, timely, and comprehensive. But the advent of COVID, unfortunately, when it came as a great reversal of this great principle, where countries and nations found themselves starting from the extreme right in a response phase and going backwards to prepare and trying to anticipate the future, which ideally should not be the way. Occupational safety and health management systems have to be designed that they resonate and deliver from left to right, where you anticipate all the way to response. But COVID-19 has taught us a great lesson that the world was basically unprepared. We have been aware of the inadequacies and even the constrained access to occupational safety and health services globally. All along, it has been in a theoretical format until the advent of COVID, when it was put to test. So this day is a special day when we talk about countries, organizations having to anticipate and prepare and respond to crisis. Two important things that arise from this paradigm are that this is not a one-time event or a drama, but it is indeed a journey in order to be able to anticipate and prepare and respond to a crisis. All that the country or the nation is doing is that it is embarking on a journey. And when we embark on a journey, it requires a collaborative approach. I'll draw parallels from two important adages. Remember, for one to invest in a resilient occupational safety and health management system, it is a journey. And as we know, that a journey of 1,000 miles begins with a single step. So this is very important. Organizations, countries, regions have to take that initial step that sets the genesis and the tone to a long journey of 1,000 miles. And that is where we are now. In order for us to invest in resilient occupational safety and health management systems, this is a journey and we need to take a step. Principle number 2, drawn from the African proverb, that says, if you want to go fast, go alone. If you want to go far, go together. There's two principles, the African proverb and the earlier on statement, they speak volumes about an approach that should be pursued in terms of investing even in sustainable and robust occupational safety and health management systems. What are the key issues and underlying fundamentals that nations and organizations need to take into place? Remember that as we anticipate and prepare to respond to crisis, the key issue that organizations have to be seized with is to make sure we have got green workplaces or we green the jobs, where systems, policies, and procedures in occupational safety and health are put in place, and more importantly, where your occupational risks are controlled, monitored, and regularly reviewed. And that takes employers to make sure that their production processes, their means of production are without risk. And this must then be achieved through a collaborative approach with involvement of the workers. And for green jobs to be realized in this quest of resilient systems, workers need to be equipped with adequate knowledge in occupational safety and health. More importantly, they need to be consulted and be party to all the processes. And of great significance is that workers have to ensure compliance to occupational safety and health management systems. So as we go through this journey, there are key imperatives where nations have to embark on a systems thinking approach, not in the current fragmented and entropic manner of managing occupational safety and health. Remember, we are coming from a situation where less than 15% of the world's population has got access to occupational safety and health services. And unfortunately, even in some African states, access levels are below 5%. So this requires nations to be in pursuit of a systems thinking approach, where at national and organizational levels, you've got that high level commitment to occupational safety and health. At management level, at policy level, at systems level, national leadership, organizational leadership requires that unwavering and holistic commitment to occupational safety and health, which then is realized or complemented by worker involvement and participation in all decisions that speak to occupational safety and health. Systems thinking paradigm also embodies such issues like program elements, where the management of risk is the key and pivotal element of any occupational safety and health management system. So that even your emergency, accident and emergency responses are built upon a sound risk management philosophy, where systems and standards in occupational safety and health are set up. And then that is then complemented by the control of hazards, which are continuously monitored and evaluated in the course of time. So in order for us to embark on this journey and invest in resilient systems that are able to anticipate, prepare, and respond, the key imperative is to lean on a systems linking approach. One of the first steps that is key and paramount to establishing occupational safety and health systems is leadership in occupational safety and health. Leadership is the most important issue that will lead organizations and nations into building up resilient OSH systems. Where the desire is to have both transformational leadership that has got the competence to deal with change, leadership that has got the competence to be able to anticipate, change the trajectory of the organization in the safety space, as well as being able to deal with the day-to-day routines that are a manifest of transactional leadership. We require leadership in Africa that will build that contagious enthusiasm towards occupational safety and health, so that at the end of the day, nations, organizations continue to build on their intellectual capital on OSH, which results in a cumulative growth in organizational memory in OSH. Unfortunately, that has not been so in most organizations, in most nations, where leadership has been lacking, and oftentimes we speak about archaic or outdated pieces of legislation, and yet we have got leaders that sit in those positions. Yet we have got people that lead OSH in organizations at national level, at regional level, but even up to this day, in 2021, we still speak about the gross inadequacies in levels of access to occupational safety and health. We therefore require leadership in occupational safety and health that is both transformative and transactional, that will bring about change, that will change the narrative of occupational safety and health, not only in Africa, but globally. Leadership in what sense? One of the major issues with any programmatic approach or any systems inception or genesis is to ensure that there's an overarching commitment at the highest management level. At this point, I'm talking about even at the national level, where we are aware of the International Labour Organization conventions that give guidance and information on occupational safety and health. For instance, your ILO Convention 155 on occupational safety and health, and its associated recommendations and frameworks that call for the establishment of national policies in occupational safety and health. Because a policy will then compel, dictate, and direct an organization or a nation to build that commitment towards the health and safety and welfare of its employees. You'll be surprised that even up to this day, you'll find that most nations in the African space still do not have national OSH policies. Remember, an OSH policy at a national level, that's the first step that sets the tone and the complexion of OSH systems within a particular state. And it is that leadership in OSH that is to advocate and ensure the establishment of national OSH policies. So countries in Africa should invest, firstly, in the ratification of the key ILO conventions, Convention 155 on occupational safety and health services and Convention 161 on occupational health services that speak about preventive approaches to the management of occupational safety and health issues at the level. So that's the initial step that we need to embark on if we are to be successful on this journey of 1,000 miles that we need to go together with the workers and the leaderships in the different organizations. Call upon in every country in the African state and globally to ensure that that commitment at the highest level is achieved. The slide that you see there, I just got an updated list from the International Labour Organization website just to look at the general profile complexion of ratification of Convention 161 on occupational health services and on 155 on occupational safety and health. And you can see predominantly in those few African countries, it's predominantly reds, where the countries are still not ratifying the key conventions. The second investment segment is to ensure that we've got competent national OSH institutions that oversee the implementation process and compliance to occupational safety and health management systems.
Sorry, you have 2 minutes more, okay?
Okay, thank you. And then we need to have these ongoing proactive systems in place. So the establishment of competent national OSH institutions is a key and a fundamental step in this journey. Regulatory frameworks, I think one of the major deficits within the African space is the shortage or inadequacies or incomplete occupational safety and health regulatory frameworks that are quite fragmented, inadequate, and that countries need to harmonize their legal frameworks and zero more on the risk management philosophy to make the workplaces safer. Step number 3, countries must invest in capacity building. At the current moment across Africa, you find that we have got a severe shortage of occupational hygienists, occupational medicine physicians, occupational safety and health practitioners, and professionals. And within the African space, very few countries have got regulatory councils to oversee the implementation of occupational safety and health. So capacity building along the field of OSH is quite key. Step number 4 is the issue of establishment of occupational health services. At the moment, you find that most organizations do not have any established occupational health service. in their workings, which is quite a significant element that drives the preventive approach and allows for the identification of hazards and the assessments of risk and surveillance of the work environment and workers. So that is quite key. And lastly, nations have to pursue practice on occupational safety and health that is evidence-based, in pursuit of a data-driven methodology, and that ingrains quality management within the practice of OSH. There's very little research within the African space on OSH, and the implementation stories and success stories have not been written. And for us to embark on this journey of 1,000 miles, it is pertinent, paramount, and quite needed now like never before to ensure that the research in occupational safety and health is conducted and its results are put into practice. Basically, to crowd it all, I end my last slide, is that for the investment drive into resilient systems to take effect and to be able to anticipate, prepare, and respond, we need good leadership in OSH. We need capacity building in occupational safety and health. We need coordinated, overarching, and comprehensive regulatory frameworks in OSH, and we require a practice that is driven by research and embraces the evidence-based practice. So in that way, Africa will go on the journey of 1,000 miles, not only individuals, but going together so that we go far. Thank you so much.
Thank you so much, Dr. Moyo. Those were very resounding points you were making. I will try and put out the things that were jumping at me from your presentation when we have all the different put together. Thank you so much for a great work you just presented. I think this is food for thought for everyone. Let's think about it, about all that he has brought out while he was presenting. We'll give time for discussion and question when we have heard the thorough presentation. Thank you once again, Dr. Moyo. We appreciate your time and your good work. Okay, here there's the Senator Muniqua. I see your hand up. You have a question? We'll move ahead. Even if it's a question, just hold on. Maybe at the end of the whole session, you can ask that question. Okay, please, ladies and gentlemen, we're bringing to the microphone right now a very dear colleague from the International Trade Union Congress, Mr. Joy Odigye. Joy Odigye is a very noble colleague of ours. He's the Deputy Secretary General of ITUC Africa. He has always worked with OSH Africa, and OSH Africa has a partnership to work across the workplaces in Africa with ITUC. So join me as I welcome Joy Odigye to present his paper. You can share your slide now, Joy.
Thank you very much, Comrade Ehi. Akato Joel Odigye is my name. I'm the Deputy General Secretary of the International Trade Union Confederation, ITUC Africa. So our organization represents close to 18 million working men and women in 52 of the 54 African countries where we currently have members. So I will just appeal to stand on already established protocol, as it were. Already, I see I'm having challenges sharing my presentation. Hello.
Natalie, can you help me empower him to share his presentation? Thank you.
It's not the empowerment, actually. It's I think it's my IT guy.
You can share the screen.
Yes, but I'm not even. My IT guy has done something beyond what could help. Let me see. Sorry for that. Okay. Is it working now?
Yes, put us a presentation, please.
Can you see it now? Can you see my presentation?
Yeah, we can see, perfect.
Yes, we can see it. We can see it. Put it on slideshow.
Okay. Okay. All right, thank you. So I will just beg to jump quickly for time's sake. And I think previous speakers, all of those persons that have given us good messages, have spoken to quite a number of the things that are pertinent that I would also like to share. So for us as workers of the world, today is International Workers' Memorial Day. In other words, we recognize that so many persons, different parts of the world, in the course of their work, have been involved in different kinds of accidents. To a large extent, quite a large number have also succumbed to their accident. They have died. So today is the day for us to appreciate their services, their sacrifices that have been very critical to the contribution of growing our Commonwealth. So we want to say thank you to them and to their families, and to say on this day and forward, we continue to remember and be with them. So just to say that it is on the basis of that commemoration that I have my slides as a background. So in other words, in remembrance of all of these persons. So thanks. So comrades have talked about the impact of COVID-19 on household, economies, everybody in different instances. For workers, it hasn't been different. And for Africa, COVID-19 has made the issue also a bit more critical, in the sense that before now, we are still dealing with our so-called 3 levels of development challenges, poverty, inequality, the actual phase of underdevelopment itself. COVID-19 is exacerbating that. And as I speak to you now, poverty is growing worse on the face of the continent. And the easiest way for me to measure the effect of poverty in my society is to just look at the numbers of handout requests that comes to people that are working. And all of the experiences have shown that these persons are also under tremendous pressure, because so many family members around them cannot survive. They cannot even eat. And so they have to be challenging out handouts right, left, center to a number of persons. Okay, so for us with COVID-19 as workers, we also see a threat. Of course, at some point you see that there are some opportunities. That with COVID-19, our continent may miss the so-called 4th industrial revolution, which, by the way, COVID-19 has even further triggered to intensify its speed and how it will work. But for Africa, the fact that we missed the agrarian revolution, we missed the industrial revolution, and the technology revolution, driven in part by globalization, or that has exacerbated or that have driven globalization, we are missing out on this process as well. And then, of course, we have seen that with COVID-19, especially when it started, until things began to open up again, there is a critical link between health, safety, and the global supply chain. And how do we address those issues later are issues of concern for us. So for the effects, you will permit me to jump, because the statistics have been presented by various persons. For instance, for us, I look at COVID-19, I look at occupational health and safety to say, whatever we are discussing today, COVID-19 is at the center of it. And so it's the basis why hush has even gained prominence. The fact that an average of 2.7 million persons die, that's a big issue. For the very fact that workers are losing jobs on account of COVID-19, that's a very big issue. The sister from the African Union pointed at that issue very strongly to say, indeed, the question of unemployment, jobs, and how we want to grow the Africa we want. If our people are still living in misery and poverty, then we know that the challenge is big. And the easiest way to grow our society and to grow dignity is through jobs. And when the jobs continue to be lost, the crisis intensifies further. And then we say for women, it is much, much worse. Because for all of this that we say, we must always remember that for all of this, there is a gender face to it. And there's the face of the, with respect to women, it hasn't been nice to see at all. And you look at that quickly with jobs. At the rate of jobs, you see how many women are losing jobs compared to men. When you look at lockdown, restriction measures, and gender-based violence, where we were the early stages of dealing with this pandemic, you saw the effect on women, young girls, and children much, much worse. In other words, for those constituencies that are considered vulnerable, that vulnerability has exacerbated. And lastly is the question of income losses. I can't say that more. Of course, there is the challenge of mental health, and I'm not an authority on this, but as a worker, I see what it's doing to our members. Quite a number of them, their anxiety is on the increase. A lot of stress to these persons. I talked earlier about those that are lucky to see hard jobs. These persons are now under tremendous pressure to be able to provide for members of their families that are not able to work. That in itself is increasing mental health. The issues of suicide and all of that, the numbers keep growing in a serious way. I've talked about domestic violence and as an effect of that. And the one I really want to touch on, which I experienced very strongly, is the so-called working from home arrangement. COVID-19 somehow seems to be making it look as if employers can then have a new way to work with shrinking more responsibilities. You now find people working from home. I just returned back to Lome recently, whilst I've been at home in Nigeria. In the course of work, I find out that, of course, you know, the challenges of power. I have to generate power to do work at home. I have to support my wife also to take care of the children because, of course, schools were closed. We became teachers. And for women, the level of support for children was even worse compared to me as a man. And then, of course, I have to work round the clock. It's not like there's a regime, 8 to 4 or 8 to 5. I have to work round the clock. And the stress, the tension of constantly looking at how to meet deadlines were high. How do we regulate working from home? COVID-19 presented the fact that as we speak, for a number of workers, personal protective equipment is still the responsibilities of workers. Employers, others are not taking the full responsibility that they ought to be taking. That needs to change. And lastly, I would say, whilst COVID-19 was still going on, violence wasn't stopping, it wasn't letting. And so for workers, the question of insecurity is a big issue. So when we talk about safety, when we talk about health, it's not just medical issue. We're talking about the physical environment. And that's why we like to introduce this dimension of a safe workplace that includes safety from attack, from violent conflict, attacks from extremists, and what have you. That in itself, we want to think when we are talking about that within the context of health and safety, we might need to find a better way to understanding this much, much later. Perhaps the connection, the nexus of this would be interested in the points Comrade Moyo made about the research. We will be interested in looking at these. So for workers, what's our position? For time's sake, let me quickly rush. Again, one of the other sisters also talked about Ebola, that there will be other disease. Comrades, yes, it's guaranteed. A global pandemic will happen again. It's not. It's clear that will happen again. I think virologists, medical experts, all of that are agreed that the chances of that happening again, they are there. The question is, with Ebola, we didn't learn anything for our continent, and that is why when it's happened in West Africa, Central Africa, it continued. And it could still is still not out of our continent, even when we are dealing with COVID-19. So the question is, with COVID-19, is there an opportunity? Whilst we have missed one, come to that. For us as workers, more than ever before, this is the time to prioritize human health as a human right. We're happy the WHO has been categorical on this. But at the workplace, how have we inserted this right? An issue we are engaging with. Okay, so for us also the question of COVID-19, and I've talked about it happening in the future. Labor inspection is a big issue now going forward. Until now, we have downplayed a bit of work on labor inspection. That is why, for instance, when you look at the ILO Committee of Experts on the application of conventions and recommendations. I'm coming to this point later. Thank you, Comrade Moyo. You make the point about standards and the need to ratify standards, particularly ILO conventions. When you look at ILO convention also on labor inspection, even country reporting, ratification and reporting, you still have crises with it. With COVID-19, how is the level of preparations? How are we dealing with a scaling up labor inspection and for inspectors to pick up their work in a much better way? That's an issue for us. We are saying as workers, we need a new and different workplace occupational health and safety policy and practices. Again, COVID-19 as an opportunity. What have we done? Maybe just to speak quickly. As trade unions, as ITUC Africa, immediately we had this thing on our doorsteps. Responsibly, we also interrogated measures others are adopting, public health measures. We closed our offices, asked our colleagues to go and start working from home. But more importantly, we mobilized African workers on the entire continent. I said we are present in 52 of the 54 African countries. So you can say fairly, we are a Pan-African organization without a doubt. The legitimacy of that claim is not in doubt. And we mobilized to say, what are governments in these countries doing? What are the gaps? And how can trade union fill the gap? We published these outcomes. They are available on our websites. If you go to www.ituc Africa's ituc-africa.org, you will see all of this compendium there. And more importantly, we told the trade unions, these are your likely rules. And we are happy that across the continent, our unions were very active. Advocacy is a big issue. And as organized labor, we have taken this to heart. He talked about working with ITUC Africa. Beyond that, ITUC Africa has gone ahead to say, we want to be part of HOSH Africa. And like everybody understands, when you talk about HOSH, occupational health and safety, the denominator is workers. The denominator is a workplace. The denominator is the community. These are the denominators in that order of priority. And when we understand this link well, our calibration and recalibration of engagement on occupational and safety management and governance will be much more sharper. And as trade unions, we continue to speak to this issue. Critically on that is that there is an ILO recommendation 205 that talks about employment and decent work for peace and resilience. To build resilience, we're in a crisis. So how do we build better forward? We need to look at some of these provisions. As organized labor, we are using this recommendation 205 very well. And more than ever before, we have seen that health issue needs to be really prioritized within the resilience measure. And we are working with other partners to really bring this even within that process. When I say we are using it very well, we are giving capacity trainings a lot to our members, and we are engaging on social dialogue with our government and employers to bring this together in a tripartite arrangement. So we also do education training and support to work. And this is why I can tell you quite a number of our members are on this platform today, on this webinar today, because we disseminated it widely and we encourage them to join, because we know that there will be much knowledge, information that they will gain. Let me not talk about it quickly. Comrade Moyo has mentioned it. Research is critical. Comrade Moyo has also talked about promoting standards, but more importantly, we want to see ratification. Beyond ratification, we want to see domestication, application, and the enforcement of the provisions of these standards. And so as organized labor, we want to work with other stakeholders to achieve greater ratification for Africa. If COVID-19 has brought about the need to do things differently, then going forward, we want to see increased ratification as an act in our self-enlightened interest. So the labor inspector architecture, we really thought we've hyped on that to speak of it. And I will round up quickly. Having said all of this, comrades, what we have found out is that for us as trade unions, we want to see more work on regulation. It is critical. In other words, how do we better regulate the occupational health and safety environment, climate? How do we better regulate it? How do we better regulate and organize work in a safe and healthy manner? When you work from home, how do you regulate working from home? I see one of my comrades here from Mauritius, and if you don't have the points, comrade Shuttle, I will appreciate you even put it in a chart what the workers in Mauritius are doing, because the workers in Mauritius are doing something very great. They have sent a bill on how to regulate working from home arrangement to their parliament. And we are hoping that when we are following that process and want to see what happens from that process, where if a best practice we can share with all other African countries. And then the question of labor inspection, we also want to see more work in that regard. More critical, important is the issue of collaboration. And we hear that this thing is about workers, this is about workplace, this is about community. We want to see a direct engagement, direct invitation, direct partnership with workers' organization. So far, it hasn't been that huge. I will commend the African Union and the Nepal Secretariat, who on the beginning of this crisis set up a very responsive African process to dealing with this. It was nice to see. We appreciated that. And that led us to be able to network with South Africa. That is how we got to know about South Africa. And in our own thinking, given that this is our issue, we said, no, we want to collaborate with South Africa. We went to South Africa. We want to see more organizations also coming in a genuine way to say, workers, these are your issues. How can we work together? Lastly, comrades, and I stop. COVID-19 is an opportunity to build forward better. If we have lost all of that opportunity, especially with the Ebola virus disease, we are happy that a global disease offers an opportunity. And how should we advance this together? It will mean us working more together in more sincere ways to build this back, to build forward, to build better forward. It will mean opportunity. It will mean for us, as against the situation where we have developing countries championing vaccine nationalism, we want to see greater global solidarity, greater global coordination of dealing with this immediate threat of COVID-19, and then much more engagement on work with respect to harsh governance in the future. I want to thank you for your time. As part of our International Workers' Day Memorial, we have a number of hashtags for today. If you're on Twitter, please, you can, any of these hashtags or your messages on Twitter, you can please tweet these messages. Thank you very much.
Thank you so much, Comrade Joel. You know, when you have a labor unionist talk about labor's welfare and health and safety, this is how it always comes out with so much passion. Thank you so much, Joy, and I really appreciate your presentation. Continually, as OSH Africa, we'll keep working together. ITUC is a core member of OSH Africa. We'll keep building those things we need to put in place in ensuring that workers across Africa are safe. I actually saw Jay Rabu from Mauritius. You can just type in for us in the chat box what you're doing in Mauritius and what you send to Parliament. And I think every country in Africa may want to also emulate that. Thank you so much, Joy. We appreciate that presentation. So at this juncture, colleagues, ladies and gentlemen, join me as we welcome Professor Wahid Amani. Professor Wahid Amani is a professor of occupational medicine in Swiss Canal University, Egypt, and she is the head technical training advisory council of OSH Africa. Professor Wahid, the floor is yours. Thank you.
Hello, everyone. Dear Mr. President, dear respectable panelists, dear distinguished participants, I would like to welcome you in this event conducted by OSH Africa and partners. This is Amani Wahid, Professor of Occupational Medicine, Suez Canal University, Egypt, OSH Africa Tech Group, and National Secretary General, ICO. I would like to participate with the crisis management. We talk about anticipation, prepare, and response to crisis. As we know, next. These are my objectives. We will talk about crisis definition, characteristics, and management. Next, please. As all know, natural crisis and man-made crisis, either chemical, biological, radiological, biological like Zika, Ebola, and so on. Facing a crisis in certain community will lead to direct and indirect effects affecting infrastructure, disturbing systems like health system, industry, education, security, etc. A crisis shows how is the resilience of the system adapt to the event. Next. During COVID pandemic, exposure may be occupational, community, or both.
Yes, come in, please.
Yeah. Different risk. What? Different risk levels at different workplaces are present. Healthcare workers, especially in the first line, are more susceptible for getting infection and adverse effects. In addition, workers in all sectors have faced other hazards that have emerged during pandemic, like stress, violence, and harassment. New work practice appears during COVID-19 pandemics for mitigation of the spread of virus using chemicals, ergonomics hazard, and psychosocial hazard. Vulnerable groups in different work sites, refugees, and those in informal sectors are at high risk. Next, please. There's some statistics about occupational safety and health during COVID pandemic. We see that closed work environment poses 18.7 greater odds for transmission of the virus. 136 million healthcare and social workers are suffering from COVID-19. 14% of all infections occur during healthcare sectors. 65% of enterprises surveyed reported that more work difficult to sustain during teleworking and virtual work. 7,000 healthcare workers deaths occur with pandemic. 1 in 5 healthcare workers suffer from mental health problem, depression and anxiety. Next. So COVID is a global crisis. It occurs sudden, unplanned, occur sequence of events and undesirable consequences. With effective crisis management, we can minimize the impact of potential crisis, avoid altogether, or in some cases, even benefit from the crisis. COVID is global challenge to health systems. COVID is global challenge to OSH. What is the characteristics of crisis? Time is short, decisions are required urgently, results into specific threats, urgent demand for information, sense of loss of control, pressures increase over time, demand are made to identify someone to blame and responsible. And lastly, communications are increasingly difficult to manage. Next. If you see one of the 10 situations in your work setting, you suspect crisis, like potential to cause injury for person, threat to health and safety of any person, threat to the environment, breakdown or threat of your reputation, serious threat to employees, morale and well-being, loss of data, serious financial loss, and legal action against our organization. Next. So in dealing with crisis management, we must deal with pre-crisis or anticipate and prepare, and post-crisis respond to the crisis. In pre-crisis, anticipate the crisis, identify crisis communication team. We must identify, train spokespersons, establish notification and monitoring system, identify stakeholders, develop holding statements. On the other hand, after the crisis occurred and prepared and response by assessment the crisis situation, finalized and adopt key message and post-crisis analysis. Next. So on crisis management objectives, we aim to reduce tension during the incidents, demonstrate commitment and capabilities, controlling flow and accuracy of information and data, managing resources effectively. Next. New regulations and managing information and protection measures and organization urgent action through social dialogue with employers and workers should be done. And by the Act, employers have duties and employees have other duties. A sound and resilient OSH system in place is essential in crisis management, in pre-crisis and post-crisis phases. Resilient OSH system give more chance to face and cope with emergencies and related outcomes. Next. Strengthening national OSH system to better respond to crisis and emergency respect 6 main areas. During national OSH regulatory framework, national OSH institutional frameworks, occupational health services, information advisory service and training on OSH, data collection and researches on OSH, and finally, mechanisms for strengthening OSH management systems at the enterprise level to prevent and respond to OSH risk. Next. On pre-crisis, we will discuss anticipate, how to anticipate. Next. Gather your crisis communication team for intensive brainstorming session to all potential crises that occur. It is very important benefit of this exercise to situational analysis, how to prevent, and the possible scenario, even best one or worst one. Next. So it is Johnson said, failure of organization to anticipate and prevent potential crisis is a rampant crisis of its own. Next. So we will look at crisis prevention by vulnerability audits, and crisis communication plan, and the third one, emergency management plans. Next. How to avoid crisis? Make crisis planning a part of your strategic planning. Get together and share ideas, work with colleagues, and analyze your situation. Perform SWOT analysis. Focus on your crisis risk list. Focus on crises that would have the worst result, would be most likely to occur, to prevent. Next. You must nominate crisis management team. With membership of this crisis management team should be based on representation, knowledge, and skill. Crisis management team duties, coordination of all crisis-related activity, gathering, reviewing facts of the crisis, determining crisis response activities, allocate resources, specify internal and external communications, training staff, establishing relationship with stakeholders, and lastly, monitor progress, continuing situational analysis. Next. So training of the crisis management team should be based on training need assessment, content, trainers, methods, and evaluation. Next. We must recognize the risk and the cost through brainstorm about the crisis, consider ways to minimize this risk and cost for each risk. Consider everything that could be wrong in the order of importance and its cost. Next. Containing crisis, one's objective should be to get it right, get it quick, get it out, and get it over. When crisis strikes, the first thing you must do is to contain the crisis. You must make decisions quickly. Be on the scene. Your physical presence is important. Communicate about the crisis quickly, expect rumors and false information, notify key people like management, general public, employee, vendors, government authorities, and client, and stick to the fact. Don't guess or attempt to cover up. Next. The ideal spokesperson should be polite, patient, well-informed, accurate, reliable, fluent, available, and trustworthy. Next. What public and media want to know in a crisis? Actually, in any crisis, we will ask about, they ask about what happened, what is the consequences of this, and injuries, extent of damage, danger, who is responsible, how it happens, what is being done about it, what is when it will be finished, happened before, is it happened before, were there any warning sign of the problem or not? Next. Media demands accuracy and simplicity, statistics which are explained, context of information, comments from highest authority, both sides of the issue, speed for contain the problem. Next. On post-crisis phase, next. Finalize, adapt key message, withholding statements available as starting point. The crisis communications team must continue developing the crisis-specific message required for any given situation. Next. We must learn from crisis, as we learn now from COVID, that OSH is mandatory on everywhere. Even healthcare industry, any other work industry, we must learn. Don't just try to put it behind you. Take the opportunity to learn from the experience and make change to avoid or prepare for another similar event. Review how the crisis was handled. Ask yourself about, could we have prevented the crisis? If so, how? At what point did we realize we were in crisis? As we know, and the COVID-19 starting from Jan 2020, with denying from everyone and even method of transmission and so on. So it must learn the lesson. Could we have recognized the science area? What warning signals went off that we may have ignored? What warning signals did we pay attention to? What did we do right? What could we have done better? Next. We have two examples of resilience of system facing a disaster or COVID-19. China is facing the COVID-19 with resilient system. All of us know that Wuhan is a source of the virus and the outbreak. How China deal with the early response and measure adopted by China, like situational monitoring, large-scale surveillance, preparation of medical facilities and supply, were all successful in reducing the epidemic in China generally and Wuhan specifically. Next. They built a coronavirus hospital at top speed to cooperate and to deal with thousands of cases. The measure taken by the Chinese government to stop COVID spreading provide an example of the community and health emergers, the leaders of the country, to follow how they prepare, detect, and respond to potential outbreaks. Next. The result, working on developing resilient systems against infectious diseases, should be one of the top priorities of any country. China incorporated resilience in its battle against COVID-19 and provide its capability to cope with the outbreak crisis. Despite succeeding in altering the course of outbreak, healthcare experts warned about possible epidemic recurrence and stressed the need for caution, and the pandemic is still ongoing, and most of the infected cases are presenting with only mild symptoms. Today, about 20 cases with mild symptoms. Next. Implementation of workplace guidelines in the Republic of Korea is another example of resilience and successful story and lesson from March 2015 adopted to deal with COVID-19. Korea suggests that approximately 15.7% of COVID cases occurred in relation to work. The government responded to the unprecedented public health crisis by developing workplace guidelines, including stipulations on physical distances, flexible scheduling, early testing of work, and disinfection. Previous one, please. Previous one. These comprehensive guidelines, next. These guidelines drew from lessons learned during 2015 with dealing with MERS outbreak and included elements of isolation, quarantine, social distance, community containment, hygiene, sick leaves, and flexible working arrangement. Implementation of these guidelines help and control the infection at different workplaces. Next. These two examples give us how resilient OSH system can compete with any disaster facing our life. Thank you, wishing you all the best, and my greetings from Egypt. Thank you.
Thank you so much, Professor Amani. That was a journey you took us through, and thank you, paper well put together, and we appreciate every effort you put in to make that happen. Very insightful, and a lot of high notes we learned from there. And I'm sure in going back to our respective countries afterwards, we will use this to build a formidable system in building back better, as the ILO put it. So thank you so much. We really appreciate that time. Dear colleagues and friends and colleagues, I'm sure while the presentations were on, a lot of us were taking questions down, taking notes on what to ask and what to add. Please, if you have questions, because I'll be looking at it as a Q&A boss, I've seen a few questions which of course were not really related to what we've been discussed. I have responded to those ones, but if there are questions you have, please, let's see you indicate by raise of hand so we can call you to ask a question. But while we wait to do that, there's a hand that has been up all day. So let me look for that, and so we can start with that. If there are questions, please just let's see you. I'm trying to figure out that hand has been up. Okay, Senator Muniqua, your hand has been up all through. We want to hear your question. Natalie, you help me unmute her so that I think she can ask her question. Senator Muniqua. Once again, Professor Mani, thank you so much for a very brilliant presentation.
I see Senator has posted something on the chat.
Okay, can you help me figure that out?
Yeah, where she was asking about the possibility of having a handout.
Oh, I've answered that already. Thanks. Okay, Jasper Miyoba, I can see your hand is up, and may we hear from you, Jasper. Oh, the hand is down. Maybe it was in error. Thank you, Ulrike Boma. I saw your message. Thank you. I know you have to leave now, but thanks for spending the rest the time you spent here with us and your great presentation. We appreciate you. Thank you so much. Questions? If there are no questions, comments, observation, country level experience, contributions, let's hear from you. But while we're waiting for that, while you still try to make up your mind, let me try and do a little highlight of what has happened. Dr. Moyo and Comrade and Professor Mani, they all spoke on very critical issue. But from Dr. Moyo, I would really love your high notes on the leadership footprint, which of course is very crucial. You talked about the conventions, the legislations that are not really strong or enabling in many countries, the ratification, and that's very crucial because we find out that Convention 161 and 155, only Senegal, I saw that from France before, Senegal and one other country are the only countries in Africa that have ratified those two conventions. It's really nice we are seeing this, and the essence of us seeing this thing is for us to go back to our countries and start nudging our legislators, our director of OSH, so that we can ratify this convention. It's very important because without this, there's really nothing we can do within the ILO framework. You threw light on the ILO framework, and again, you were very strong on building capacity, which of course I really support. We need to build more capacity in Africa in the area of OSH, and that's why the issue of investment in people has become very crucial. You talked about data. We need data because without data, you can't plan. We need data. Let's start gathering our data, no matter how little it is. Let's start putting them together so that they become enabling data to making positive plan in developing OSH in Africa. Regulatory framework, we need that. We need that strongly in Africa because most times there are things we have to do. I'll give you an example. In some countries in Africa, when you talk about workplace mental health, they're still using the lunacy ordinance, of 1958, and that does not relate to the current realities that we have on ground. What those legislations are, let's start repealing them, let's start reviewing them so that they can meet the current status quo. The research, we really need research to happen, more research, and that's why OSH Africa, one of the key agenda of OSH Africa, so that we can start relating, internationally within each countries. There's nothing wrong with somebody from Eswatini being able to do research with somebody from Kenya, somebody from Togo being able to do research on somebody from Angola. We need to start working together. It's very important that we make all this happen. Dr. Moyo, thank you so much. Those ones really jumped at me in your presentation. I just felt I should mention them. Comrade Joy, very brilliant presentation. I like the route you went on gender disparity and the crisis that the female workers were having during this lockdown, where you have people being domestic violence became a very key issue also that characterized women. They were being multitasked in diverse ways, and that was very crucial. Mental health also was heightened, and remote working also became a big problem, where we saw pictures of women trying to attend to their spouses and their children and still having to work at the same time. These were strong issues we have to go through in Africa and across the world. Yes, you made very strong points on Ebola. Ebola came, but I really think there was no lesson learned. So we need to take this pandemic that has come right now. What are the ills and what are the lesson gains? What are the pain? What are the gains? We need to start building on the gains and learn from what we didn't get right. It's just a better approach in building back stronger. They also talk about prioritizing employees' health and safety as part of human rights. I strongly believe employees' health and safety should be seen as an integral part of this fundamental human right. We need to build a system where workers that come to work are able to go back to their family the same way they came to work. If we took employees from their families and bring them to our workplaces, it's our responsibility. We owe it as a duty of care to return those people back to their family, because when we hurt one employee, it's not just the employee that we hurt or harm that is the issue. Is the multiplier effect of the families that the employee was a breadwinner to, and we must consider that when we are making our safety decision within our workplaces. And we also talk about the work that ITUC have done where the COVID-19 broke out. We talk about the advocacy, the mobilization, the education and training, the research you have done, then also overhauling the labor inspection. Comrade, I need to talk more with you on that after this program, because OSH Africa also has what you call African OSH and Labor Inspection Network. We need to see how we can work together in direction in ensuring that what you have and what we have, we put them together in building a stronger labor inspection in Africa. Thank you so much. Those were very critical points you highlighted in your presentation. Professor Mani, thank a very well-researched program. You talk about the COVID-19 and the risks that are associated with it. You talked about you gave up very strong data. 7,000 healthcare workers, lost their life during this COVID-19. 1 in 5 healthcare workers suffered mental health. That's the record so far. And even as the pandemic lingers on, we still have more people still suffering mental health. You talk about the characteristics of the crisis, and that was very strong. The time is too short, but yet we still have to make decisions. So we must understand that we need to anticipate what will happen. The need to train our people to prepare for it in way of response is very crucial. You also talked about how to recognize crises and also interpreting this cause. Very crucial. We must learn how to recognize crises as they happen and also try to interpret what are the causes. What do we stand to lose at the end of the day? You talk about the post-crisis and the pre-crisis era. Then the 6 key elements of national OSH system, which of course every speaker have talked about. We need to invest in OSH system. We talk about the crisis management and how we must train these people who will be part of the crisis management team. They must be skillful, they must be knowledgeable, and they must be passionate about what they're doing. They also recognize the risk of crisis and associated costs, because we need to start putting crisis and attaching costs to it so that you understand that everything that we get involved in, every crisis that we have, there is a cost to it. We're talking about poverty in Africa. We don't have enough funds to start allocating to this. So the best way we can manage our crisis is to prevent it. We talk about we must contain crisis immediately they strike. We shouldn't allow them to escalate before we start running up. And at the moment they strike, we must look for a way to contain it before it spreads beyond our control. Then you talk about we must have an ID spokesperson. And that I think that what you meant is the incident commander. So when crisis happens, it's not everybody that must speak to the media, that must speak to those that want to hear. There must be a central incident command center, somebody who must be knowledgeable of what's happening on ground and must be able to speak adequately on issues that we need to communicate to the public. it's not everything that happens within the crisis that must communicate to the public. There's information we need to work in mitigating the crisis without the public actually knowing. You talk about the crisis management. You talk about learning from the Chinese response team. I would, of course, these were very key highlights that we heard from what you presented. Thank you so much. Very wonderful papers we heard. We listened to this afternoon, and we appreciate all your effort. I just want to hear from our colleagues who are here. Let's hear your questions. Let's listen to your queries. Let's hear your comments if there are. Moyo, help me look at the chat box. I can see from the Q&A session right now, I see Michelle Nsimbi saying, in as much as we can prepare, in as much as we can be prepared in workplaces against COVID-19, social distancing is difficult, especially in the transport sector. The workplace can be made safe, but the journey to work is where some people are getting infected as they use public transport that is limited. How best can we curb the spread of those who cannot work from home? Dear speakers, Dr. Moyo, maybe we'll start from you. You need to help us out. I think in the training we're doing for the Lesotho government, I think this came up also, if you remember. So let's hear from you, and so that others can also add their views. Thank you.
Okay, thank you very much. Yes, the question from Michelle Msimbe about the challenges faced, particularly in the public transport. I think one important thing to note is that I think the safety and health culture is still a distant element in the horizon for most people, over and above the current circumstances. Where, for instance, you find even the wearing of masks, the overcrowding, people do it indiscriminately. But until such a time when we can ingrain a culture of safety into the masses, that's not a mean task, but obviously it will take quite concerted efforts in terms of changing the culture. Yes, in public transport, the ideal is to maintain the social distancing as prescribed, because the moment that is violated, it then puts people at risk. So in terms of transportation, I think if countries could still be very strict in terms of policing this social distancing across all elements, that would go a long way. But it would also take training and the education of the nation. Like what Mr. President has just said, recently, the government of Lesotho, with the assistance of the African Union Development Agency, thanks to Chimumwe Chamdimba and team, recently conducted a nationwide training on risk assessment, because once people understand risk assessment, they'll be able to do it on their own without even at times anyone policing them. So we still need that awareness, that education and training, particularly in risk management and also adherence to the set restrictions. Thank you.
Okay, thank you, Dr. Moyo. I can see a question from, I think, Helen also, but what you asked, okay, Christiana, I think what you asked, what are organizations doing in terms of risk assessment on ergonomics issue that people working from home are prone to working fully when the most workstation in homes are not of ergonomic design. You want to take this, Moyo, or you want me to?
I can never go on it. We can always add.
Okay. The truth is, we knew, like we said earlier on, that the workplace, the ergonomic of our homes were not what we had planned out before there was a compulsory lockdown. So we understood the fact that we all went home and to work from our couches, our dinner seats, and our sofas, because we didn't have well-planned ergonomic station. Even from the research that had been done, only about 32% of people working actually have well-designed workstation in their homes. But what we can do, I mean, what most organizations have been doing, I mean, modern day thinking organization is one of such is a solution. If you have ergonomic seats in the office, in your offices that you procured for your staff, but remember, for the past 1 year, these employees have not been to the office. So it just means those ergonomic seats are in the office and they are wasting. It's just a common sense that you sign this ergonomic desk and seats out for this employee to take to their homes. The record shows that this company's properties are with this employee. So in such a time that we all come back home, come back to workplace again, they'll return it. But now you have somebody that already be profiled having existing ergonomic conditions, but his or her condition is being complicated by awkward seats that he's using at home, while the ergonomic seat that was procured for the person is lying waste in the office. I think these are some of the things we need to do. But some companies also made their employees to also procure ergonomic seats and send the payment receipt to the company for reimbursement. These are some of the ways that this has played out from the little research we have at our disposal. It's not a one-size-fits-all approach. Look at what works for you, but I think assigning your work seat to you and taking it home wouldn't be a bad idea. I think that's even a quick fix to this issue. We understand that most people are going down in pain today based on economics, poor working condition. But look at that option. Suggest your management. They can sign up those seats for you to take home. That will help a great deal. Thank you so much. I hope that answers your question. Any other question you can figure out?
No. No, I think we've answered. Unless if there's another someone.
I think our time is fast spent now. We'll be closing this session shortly. But before we do that, let me just quickly pull this up. I just want to use this opportunity to thank everyone that have joined and partnered with us, supported us in making this happen. OSH Africa on its own couldn't have done this alone, but with generosity and contributions and support from all partners, we made this happen. I don't know if Hanks Kolonwiski is still here. I want to thank you and your team from ORP Foundation, International Foundation. From the first day we discussed this with you, Pablo, I don't know if you're here, and Natalie, from the first day we had this meeting, the zeal you showed towards supporting us in getting this done. I mean, you can't get that anywhere. But in going forward, we'll continue to build on what we started and ensuring that we keep African workplaces safe, not just for these generations, so that the generation to come, we see the great work we have done. Thank you so much. We appreciate all your effort and time and support. We also want to thank the National Institute of Occupational Health South Africa. We appreciate you for all the support, always standing by us and the partnership we've enjoyed over the period. We want to thank Chimwe. I used to hear AUDA. I mean, always there to work with us. We appreciate your time, your effort, and continuous partnership that we have in building the Africa that we want. Thank you so much for the time and your support. We also want to thank NETOSH, European Network on Training on Occupational Safety and Health. Dr. Ulrike Bowman, I mean, anytime we call on Dr. Bowman, she always shows up. Thank you so much. We enjoy the partnership, and you are the first organization that OSH Africa had MOU with, and this has just been going for us in a very great dimension. We appreciate your time. ITUC Africa, we thank you all, not just ITUC Africa, ITUC globally. I mean, Owen was also in strong support of what we're doing, and Joel and Kwasi from Ghana, Rhoda from Ghana. We appreciate all your effort, support you've given to us in making this happen. We just thank you so much, and God bless you. We also want to thank the team of Workplaces Without Borders, Marian. I saw Alec earlier on. I saw Claudina. Please, we just want to thank every one of you for the time you've allotted to spend time with us today. And I hope it has been worth your time, and great presentation, and it's good to see you stay from beginning to the end. I mean, what we try to do here is to bring Africa to the world and bring the world to Africa. So I think this is the part we are doing. But we continuous partnership with you and everyone in Workplace Without Borders. We keep creating that network we have, and we talk about globalization. Globalization is bringing everybody in the world together into a small nucleus where we can work together and achieve our dreams. Thank you so much for your support. We appreciate you. Thanks a lot. We also want to thank Africa Regional Labor Administration Center. My friend Lokari was here to present the message on behalf of the center. We really appreciate you for the time. We work with you severally in many projects, and we look forward to working with you in going forward and over again. This partnership does not end here. We keep pulling ourselves together and pulling forward together until we are able to build the Africa that we want. Thank you so much. We also want to thank Justin and a colleague from the World of Safety and Health Asia. Thank you so much for your support and the very stimulating discussions that we have going on the projects that's going to happen between your organization and Africa. We look forward to that, and we are very optimistic that it will be a great deal for Africa and helping us develop our people and pushing this game beyond where it is now. So on this note, ladies and gentlemen, I want to again thank everyone, participants that have come to attend this program. I hope it was worth your time. 2 hours spent together. I hope it was worth your time. We'll look forward to hosting more. We have your data, so when programs coming up, you will be the first to know. We have a lot that will happen within the year. As we go into the future, and we just thank you for staying with us to the end. On this note, ladies and gentlemen, it's always said in Africa that whatever has a beginning. On this note, to our program, and we will say thank you very much and wishing you the best of the rest of the day. Thank you, and God bless you.
Thank you. Bye-bye. Cheers.
Thank you, Iha, and everyone. Bye.
Thank you, Iha. Thank you.
Thank you.
Have a good day.
Thank you so much. Yes, everyone.
Happy Host Day.
Thank you. Bye-bye.
Bye-bye.
Bye.